Hello and welcome to this revision podcast on surgery. Your surgery exam will be about events between 1845 and 1918 specifically, but you will be expected to know about events in the earlier 1800s. The paper will be about one of three things based upon the three problems that the surgeons faced before 1845: shock, which includes pain, infection, and blood loss. So let's have a look at the background. If you had to have an operation before 1845, it would have been a last resort because it was extremely dangerous and the chances are that you would die. This is because you would either die of shock from the pain, get an infection from the dirty knives which would kill you, and you could get that from the environment as well, or you would die from losing too much blood. Because of all these reasons, surgeons such as Robert Liston would try to complete an operation as quickly as possible, to stop you from losing so much blood, to reduce the risk of getting an infection, and to reduce the time the patient spent in pain. His record was 26 seconds, and he made a point of trying to beat it in front of an audience. They would consider that entertainment because it was bloody, there was lots of shouting and screaming, and it was gruesome. Plus, it's always fun to try and see somebody break a record. This speed led to some famous disasters in surgery. Once, a man's testicle was lopped off because of the sheer speed of the cutting. They did get off the leg as well, though. Another time, an amputation led to a 300% death rate in the operation. The patient died of an infection from the cutting. A bystander was cut and also got an infection which killed him, and another bystander thought he'd been stabbed and died of a heart attack. The first problem to be solved was pain and the resulting shock that it caused. Many anaesthetics had been used in the past, such as opium, laudanum, mandrake, and even alcohol. But whilst this dulled the pain, none of them knocked the patients out fully, so it didn't solve the problem of having to do such rapid surgery. In 1799, Humphrey Davy, famous for other things such as the Davy lamp, discovered the effect of nitrous oxide. However, he didn't realise the benefits of its use in surgery and just used it for social reasons with alcohol, and it was ignored. The real breakthrough came when ether was discovered by Crawford W. Long in 1842. On the 21st of December 1846, Robert Liston removed a leg using ether. Ether knocked out people, which made surgery on them a lot easier. It reduced the pain and the shock, but it did cause coughing, and it was irritable to the eyes and was highly flammable. It sometimes even exploded in operating theatres. So surgeons were on the lookout for a better anaesthetic. James Simpson was one of these men, and in 1847 he was testing different chemicals on himself and his friends when he tried chloroform. This, luckily, knocked him out. Any bigger dose and he would have died. Any smaller dose and he wouldn't have realised its importance. He used it on over 50 women in childbirth and was pleased with the outcome, noticing it had less nasty side effects than ether. Many people opposed the use of chloroform though. The church thought it was unnatural not to feel pain. Others said the long-term side effects were unknown. And when the first patient, Hannah Greener, died in 1848, Simpson's argument for it faltered. This argument continued until 1853, when Queen Victoria used chloroform during the birth of her 8th baby, Leopold. Jon Snow, by the way, did the operation. After that, most people accepted chloroform, as Queen Victoria said it was soothing, quietening, and delightful beyond measure, in exactly that voice. This was good on the one hand, but on the other it led to more deaths because surgeons could spend longer on operations, and this meant more chance of infection or blood loss which hadn't been solved yet. They could also go deeper into the body, which was also dangerous. This period was called the Black Period of Surgery. Later on, local anaesthetic was discovered, dulling pain in certain places without knocking the patient out. Carl Koller, nicknamed Coca-Cola, found the first one, which was cocaine, hence the nickname. And he used this mainly in eye operations, and for the first time in 1884 when he discovered it. Ignaz Semmelweis realised that doctors who delivered babies without washing their hands caused puerperal fever, which killed women and babies. It's sometimes known as childbed fever. Unfortunately, he could not prove this, and he went mad trying to persuade people to wash their hands. Ironically, he died in a mental asylum of an infection. By 1861, germ theory had been proven by Louis Pasteur, of course, and by the mid-1860s it had been linked to disease. In 1866, Joseph Lister based his ideas on this germ theory and cut the death rate amongst his patients from 46% to 15% by spraying carbolic acid, an antiseptic, on instruments and bandages that he was using. By 1867, he developed his technique to include a spray which drenched the air, the surgeon's hands and the patient from an aerosol type machine, and this massively reduced the death rate, though some surgeons opposed it as it was time consuming and uncomfortable. Anyway, this antiseptic surgery did catch on, and it led to something known as aseptic surgery. So they tried to get rid of all germs before the operation. Whereas before operations had been done in people's homes, in random rooms, now they needed clean rooms in hospitals, and surgeons started boiling their instruments, scrubbing walls down, sweeping the floors, and even using rubber gloves, gowns and face masks to stop the infection from happening. So this was the beginning of aseptic surgery, and it allowed for more ambitious surgery to take place. For example, the first appendix operation in 1883, and the first ever heart operation in 1896 after someone was stabbed in the heart. The last problem to be solved was blood loss. In the past, surgeons had cauterized wounds with boiling oil to seal them up and stop infection. Paré famously rediscovered from the Romans an ointment which was less painful and worked as well for an infection. However, it didn't stop blood loss. His ligatures, which were a tight silk thread around the vein or artery, did, but it still often caused infection. Lister's antiseptics meant that these ligatures could now be used more safely to stop blood loss, but if you'd already lost too much blood, there was nothing you could do. People had tried to transfuse blood from one person or animal to another before, but had failed for many reasons. The main reason is that the blood clotted and killed many of the patients. As far back as 1495, the Pope had been given the blood of 3 10-year-old boys. They all died, and so did the Pope. In 1670, Jean-Baptiste Denis killed a Swedish baron trying to give him cow's blood, and transfusions were banned in Britain and France from then on. But by 1818, James Blundell had successfully performed the first blood transfusion from a husband to a wife, and by chance, the blood was compatible. Out of the 10 transfusions that he did, 50% of the patients died. He didn't understand why. The main breakthrough came in 1901 where Karl Landsteiner discovers blood groups. He realised that if incompatible blood groups are mixed, the blood will clot and the patient will die. But you still had to be next to the patient that was getting the blood transfusion to give it. But in the 1910s, blood was able to be refrigerated and an anticoagulant added to keep it for a few days. This paved the way for blood banks, stores of blood, to be used as necessary. In 1913, Richard Lewison discovered that sodium citrate stopped the blood from clotting during an operation. And the First World War acted as a catalyst for rapid development of both blood transfusions and blood banks. And the first transfusion using cooled and stored blood was in World War I in 1916. The other major breakthrough in surgery was in plastic surgery, undertaken by Harold Gillies in World War I, using skin grafting techniques to repair the mutilated faces of thousands of soldiers. His invention of the tube pedicle allowed him to roll a flap of skin still attached to the chest or forehead into a tube, and that would stop infection and continue the blood flow to stop the decay of the flesh. And then he would swing it over the face and reattach it and stitch it on. His cousin Archibald Mackindoe carried on the work of plastic surgery in World War II. So obviously these are the main events and individuals. Anaesthetics with mainly chloroform and Simpson, antiseptics with mainly carbolic acid and Joseph Lister, and blood groups with mainly Karl Landsteiner, who discovered them. But there are other things that affected surgery in this period. Technological inventions, scientific knowledge, the germ theory, for example, war, as we've seen with World War I. And you may get asked a question on which factor was most important. So you might have to compare which one you think had the most impact on surgery. Was it the individuals? Was it the technology? But what questions are you going to get? Well, the first type of source question you're probably going to face is an extraction or inference question, where it'll ask you what you can learn from a source about something to do with surgery. So you're going to have to either pick apart a picture or some text and look for the obvious clues first. You must use the text, so use quotes, or you must use the picture, describe what's going on, but you must develop it, pick out 3 things that are obvious and develop what you can infer, what is implying, what is it telling you that's not obvious. You need to stick to the question. You don't need to go into how trustworthy or reliable this one is. You're just making an inference, the obvious clues are less obvious clues, and then backing them up with references to the sources. It's better to make 2 supported inferences with information from the source than it is to make 5 or 6 inferences that you don't back up by referring to the source. The next type of question you're going to get is a cross-reference or a similarities and difference question. It's going to ask you to compare and contrast a number of sources. It will ask you whether the sources agree about, what do they differ about, why is source A's interpretation different to source B, and you need to make a judgment right from the start to say to what extent you're evaluating the extent of how much one source supports the other or the others, or maybe it will challenge it. Don't just describe what's going on in the sources, you need to give this overall message, and again back it up with details, quotes from the sources. With this one you can compare how reliable, how trustworthy, how accurate they are. The third type of question is a portrayal question, which is similar to the inference, except you need to focus on what this source is suggesting. So the emphasis is on how an impression was deliberately created by the author or the artist. Again, like inference questions, you don't need to discuss how reliable the source is or how useful it is. You just need to explain how the writer or artist has set out to create a specific impression. Say what the obvious clues are again, and then infer the less obvious clues from it and back it up from the sources. What did they choose to include? How did they portray it? What words, what colour, what tone of message that they're using to create that impression. The fourth type of question you could get is a usefulness or a utility type of question, which is asking you how useful is source D, or which is the most useful, source F or H. You're going to use your ABCs. You're going to say how accurate each source is, how biased each source is, how complete each source is, and that will include how representative of the bigger picture. So you need to talk about the content, what you can learn, and which is the most useful in terms of the detail of the content, and which is the most reliable. If you can put them both together, make an evaluation of which one is the best from that, then you can get top mark. So you need to do a conclusion in that one with an overall judgment. The final question is always 16 marks. You will be judged on your spelling and grammar, and it will give you a quote. For example, anaesthetics were the most significant surgical breakthrough of the period 1845 to 1918. How far do you agree with this statement? Use your own knowledges and some sources, and any of the sources in the whole thing you can use. For this one, you must do both sides of the question. You must agree with it and you must disagree with it, or you must give some balance. You must argue for it and against it, and do that in a burger type essay. So you do 1 paragraph for, 1 paragraph against, but use the quotes from the sources that specifically ask you to back up your arguments both for and against, and then do a conclusion where you don't sit on the fence and you make an evaluation of whether you do agree or whether you don't agree. You can and you should judge the reliability of and usefulness of the sources in this question as well. And again, use quotes from them to back up your points. Plus, you must use some of your own knowledge that isn't in the sources, otherwise you can't get the top level 4.